Myself, Dr. Chandan Mahesh, consultant implantologist and root canal specialist, practicing at Implant Dental Care at HSR Layout Sector 2, 19th Main. As we all know, wisdom tooth is something which comes after the age of 20 or 22. For male patients and for female, it can be much more earlier, maybe at 18 or 20. Wisdom tooth arises in two ways, that is horizontal as well as in vertical position, because the jawbone, whatever we've been gifted with, the DNA which we inherit from our parents, so doesn't be the same as in one patient to the other patient. So the tooth bud which likes to erupt will be depending on the jawbone or the length of the bone which is being gifted with. So sometimes when the wisdom tooth comes vertically, it will be a challenging thing for the dentist, wherein he has to particularly cut the bone a bit and slice the tooth into 2 to 3 slices or even 4 slices and get them in bits and pieces, which involves a lot of grinding and drilling of the bone as well as the cheeks which will be retracted. So at that time, the particular patient will be informed wherein the bone loss is one thing, and second most thing is the post-operative extraction or the post-operative vertical impacted tooth. So post-operative vertically impacted tooth takes a bit more time than the horizontal impacted tooth. The reason is vertically impacted tooth, as I always said, it is almost in a slanting position or a sleepy tooth position, wherein we slice the tooth into multiple slices. So we all know surgical, whenever we intervene the procedure, there will be much more complications as well as time taking to heal it. So there will be sutures which the dentist will be providing and instructing him not to take anything spicy, not to gargle, not to take anything hot. The only reason is the clot factor which forms in the particular tooth, if it is disturbed, it leads to multiple problems like infections of that area or a dry socket or anything X and Y, wherein it might be leading to trismus, which will be difficulty in opening the mouth as well. So horizontal tooth impaction is quite simple, wherein nowadays the dentists follow, or I myself follow, an elevated technique wherein I don't use much of surgical blades or anything as such. I just elevate it with my luxators or elevators, wherein the tooth which is positioned horizontally will be raised and the particular tooth is out. It is much more less painful and asymptomatic, and the patient will recover very sooner given a week's time, and he'll be back to his routine works. But a vertical impacted tooth, which is a slanting tooth, might take at least 15 days to recover completely, and he will be back to normal with the antibiotics and the painkiller. But the antibiotics as well as the painkiller would be the same, but the duration of it would be more for the vertically impacted tooth, and the horizontally impacted tooth might be taking lesser duration for the antibiotics as well as painkiller. And the post wisdom tooth extraction, we tell the patient to give a ice pack over that and rub on top of it for the first 24 hours, and the next second and third day maybe we tell him to give a hot fermentation, because cold pack will not be helping him for the first 24 hours which help. And post 2 to 3 days we just ask him to do some physiotherapy. What is physiotherapy? Is trying to open his mouth wider and continue his day-to-day habits after a week's time, because the particular area where the tooth was lying, it gets covered with the particular natural bone and there is nothing to be replaced with after the removal of a wisdom tooth.